May is National Stroke Awareness Month. The focus of the month is to make Americans aware that they may be able to save the life of a person experiencing a stroke. Knowing the risk factors can lower your own chances of suffering a stroke. Here to explain more about the types of strokes, how to help someone, and where to seek treatment is Vikki Smolik, a registered nurse and stroke coordinator for Baptist Healthcare. Vikki, thank you so much for coming on today.
Thank you for having me.
To get started, share a little about yourself and your experience as a stroke coordinator at Baptist Healthcare.
Well, I grew up here in Pensacola. I've been here for 43 years. I come from a very large family, a very community-involved family. And I went to nursing school and graduated in 2000 and took a job at Baptist Healthcare. I've been at Baptist Healthcare now for 17 years. My majority of my background is critical care, ICU, trauma, post-surgical care. And then I was asked to be the stroke coordinator in 2014. So I've been the stroke coordinator for both Baptist and Gulf Breeze campuses since January of 2014.
Okay. Now I understand that this topic hits close to home for you. Why is that?
Well, back in 2011, I had actually been out of the country on a mission trip, done some medical mission trips with our church, came back and really didn't spend enough time off before I went back to work. And I was on my fourth 12-hour shift in the ICU as the charge nurse. And I had a sudden onset of loss of vision, peripheral vision, garbled speech. My brain knew what it wanted to say, but my body was not cooperating. Also had a facial droop and numbness and tingling in my right arm. Really, my first instinct was to deny that this could be a stroke, even though with all my knowledge, I knew that's what it was pointing to. So the night shift nurse took me down to the emergency room and insisted that I do a workup for stroke. And about 45 minutes into the entire workup, all my symptoms resolved, and I was left with a tremendous headache. It ended up being a complex migraine. Complex migraine can mimic a stroke. It is one of the stroke mimics that we look for. But we also know that had I not been in that place at the right time, and it was a stroke, it could have been much more devastating for me. In that 45 minutes, it taught me a great deal. It taught me really that physically it was not painful. Emotionally, it was wrenching to have a body that wouldn't cooperate with what you wanted it to do. So I was very thankful, and I really feel like that 45 minutes was a gift to me to understand what it feels like to have a stroke and to be able to better take care of our patients. So,
yeah, wow. So tell us the difference between a stroke and a mini stroke.
Well, there's several different types of strokes. There is a hemorrhagic stroke, which is a bleeding stroke, and there is also a clotting stroke. We call that an ischemic stroke, and then a mini stroke, which is actually a TIA, a transient ischemic attack. A transient ischemic attack will look just like a stroke, a full-blown stroke. The signs and symptoms are the same for each of those types of stroke. It is not until we get the patient into the hospital and do a CT scan can we actually know if it's a bleeding stroke. Rule that out, first of all. And a mini stroke usually lasts minutes to an hour. We call that a mini stroke, but that's actually your warning sign. That is a warning sign of a bigger stroke to come. So you are 5 times more likely to have a full-blown stroke if you're having mini strokes or TIAs. So we encourage the same process. Not only that, it's such a time-sensitive emergency that we don't want the person to stay at home and hope that it goes away.
Right. Now, what causes a stroke and how long do those symptoms typically last?
A stroke can last minutes if it's a small mini stroke, as we said. And if it is an ischemic stroke or hemorrhagic stroke, it can have very profound signs and symptoms or very minor signs and symptoms. Some of your risk factors for stroke are high blood pressure is one of the big ones. Relatively 80% of all first-time stroke victims had a blood pressure greater than 140/80. This statistic comes from the American Stroke Association. Also, about 80% of your risk factors are controllable risk factors or modifiable risk factors. Some of those risk factors include irregular heartbeat, such as atrial fibrillation, diabetes. Smoking actually is a huge risk factor for stroke. It doubles your risk. Smoking alone doubles your risk of stroke. Physical inactivity, high cholesterol diet. So diet and exercise are something that you can do to help prevent a stroke. And all of those things need to be discussed with your primary care physician and really understand what is your personal risk factor. So we really encourage patients and their families and the community to talk about what their risk factors are for stroke. A lot of times we don't mention those things when we go to the doctor, but really being proactive and understanding what your personal risk factor is a good start.
Now, what are some signs that others can be aware of to maybe get a stroke victim help?
Well, there are some things that we teach the public. We call it the FAST signs and symptoms. And actually, there's now being a push to add B and E to the beginning of that. So be fast. Mm-hmm. And be fast is the B stands for sudden onset of balance or coordination problems. The E is for eyes, and that's a sudden loss of vision in one or both eyes, or blurry vision in one or both eyes. Those are your subtle signs and symptoms. The more obvious signs and symptoms we teach are the FAST. FAST being the F is for face, a sudden onset of facial drooping. The A for arm, because it fits the acronym well, but it can also be the limb, the leg. And this typically is one-sided, but it can be both sides, and that's weakness. Numbness and tingling can also be a sign. And then the S we teach is speech. And just ask the person to say something simple like the sky is blue. Does it sound articulated well enough? Does it sound their normal, or is it slurred, or maybe they can't pronounce the words at all? And then T is really the biggest factor in that acronym, and that is time. Time is of the essence. Stroke is a medical emergency, and it is just as important as if you were having a heart attack or had a traumatic injury of some sort. So we want you to call 911. It's time to call 911 and get the help you need.
We just have a little bit of time left, but I want to hear from you. What are some proactive measures we can take to avoid a stroke?
The biggest thing is if you smoke, quit smoking. If you have high blood pressure, make sure it's controlled well. Don't take yourself off your medications abruptly. Make sure you're communicating with your primary care physician and those that you're under their care. Get regular exams from your physician and be proactive and ask, what are your risk factors for stroke? Eat a healthy diet, get exercise, and regular exercise. We recommend at least 3 to 5 times a week. Walking is a great way to de-stress and to get some fresh air and exercise. Control your stress in your life. Stress is a big factor. And now on the rise is really a focus on dehydration. So we're getting into some really warm months now in the Northeast Panhandle here. So we want to make sure that we are getting plenty of water when we're outside. Even a heat stroke is a stroke. So we want to be mindful of, our lifestyle with the changing months as well.
Sure. Well, great tips. Thank you so much for coming on and discussing that with us, Vicki.
I appreciate it. Thank you very much.